So he has asked me to make a small sponsorship speech for House Bill number 7293. Good morning to our distinguished colleagues, guests, and valuable resource person. Today, I have the privilege of sponsoring House Bill number 7293. This legislation seeks to increase the bed capacity of the Drug Abuse Treatment and Rehabilitation Center in Ilagan City, Isabela, from 128 to 200 beds. Representative Albano believes in a more rehabilitative approach to addressing the drug problem in the country. Many people who have fallen victim to illegal drugs are men and women who need only a second chance to get their lives back on track. As such, the government must help them recover so that they may live on to become productive citizens. Suffice it to say that we must be wise enough to recognize when to employ force and when to exercise compassion in our efforts to combat the drug menace. Through this act, the said facility will be able to adequately and swiftly provide the necessary services for the successful recovery of its patients. Thank you so much, Mr. Chair, and please note that Mr. Representative Albano sends his heartfelt thanks to everyone as well.
Thank you very much, Honorable Estrella. May we hear a response or reaction from the Department of Health? Engineer June Philip Ruiz is now recognized.
Good morning, Mr. Chair. Good morning to our honorable representatives. I am Engineer John Philip Ruiz of the Health Facility Development Bureau of the Department of Health. Please allow me to state the DOH position paper. So the Department of Health supports the intent of the House Bill number 7293, which seek to increase the bed capacity from 128 to 200 beds of the Drug Abuse Treatment and Rehabilitation Center in Ilagan City, Isabela. Based on 2022 Health Service Information System, Cagayan Valley has a population of 3,727,548. The 2019 National Household Survey on the patterns and trends of drug abuse indicates that Cagayan Valley has recorded 26,713 individuals aged 10 to 69 years old who are using dangerous drugs substance during that time of the interview, while the estimate number of the lifetime users was 116,842 the time of the interview. The Drug Abuse Treatment and Rehabilitation Centers in City of the Ilagan, operationalized since 2017, was the sole rehabilitation center, which provide all drug rehabilitation, intervention, aftercare, and follow-up programs, projects, and activities. It caters to patients from Cagayan Valley and from the neighboring Caldera Autonomous Region, provides such as Apayao and Kalinga. Currently, its bed capacity was 93.74%, which was above the ideal BOR of 85. Further, its inpatient and outpatient aftercare census in the second quarter of 2013 was 144, 772, and 565 respectively. In view of the foregoing, the DOH interposes no objection to the increase in the bed capacity of the .RC Ilagan City, Isabela, from 128 to 200 beds, provided that its development remains consistent with its facility development plan and licensing and accreditation requirements of the Department of Health. Respectfully submitted. Also, please note that this position paper will be sent to the committee once signed by the Secretary of Health. Thank you.
Thank you very much, Engineer Ruiz.
Mr. Chair, I move
Yes, Honorable Long Chuan.
Mr. Chair, I move for the approval of House Bill number 7293, entitled An Act Increasing the Bed Capacity of the Drug Abuse Treatment and Rehabilitation Center in the City of Ilagan, Province of Isabela. I so move, Mr. Chair.
Second.
So there's a motion to approve House Bill number 7293. Hearing no, duly seconded, hearing no objection. House Bill number 7293 is approved. Congratulations.
Thank you.
We now move to House Bill number 8198, an act establishing a general hospital in the city of Alaminos, Province of Pangasinan, to be known as the Alaminos General Hospital and appropriating funds therefore by Honorable Robert Raymond Estrella and Honorable Arthur F. Celeste. Honorable Celeste is now recognized.
Thank you, Mr. Chairman. This bill is filed by yours truly and of course our good congressman from Abono Party List, Congressman Eskimo Estrella. And I was tasked to do the sponsorship speech, Mr. Chairman. So good morning, Mr. Chairman, distinguished colleagues and guests. Today I am honored to introduce to you to this committee House Bill number 8198, an act establishing a general hospital in the city of Alaminos, province of Pangasinan, to be known as the Alaminos General Hospital and appropriating funds therefore. So first, I would like to inform everyone that Pangasinan is the third biggest province in the Philippines, which covers 818 hectares of land and nearly half of the Region 1's total land area. Ang ibig po sabihin, sa Region 1 po, pagsamasamahin ang La Union, Ilocos Sur, and Ilocos Norte, kasing laki lang po yan ng Pangasinan. So secondly, our population is approximately 3.2 million in Pangasinan alone and covering 44 municipalities and 4 cities. Based on the Department of Health National Health Facility Registry as of May 23, the province has 40 registered and licensed hospital. 15 po rito or 37% are government owned. At saka 25% or 63% are privately owned. Furthermore, there are 17 infirmaries or primary care facilities in the province. 18 hospitals are government and 14 hospitals or 82% are privately owned. Presently, there are 5 level 1, level 3 hospital, 5 level 1 and 3 infirmaries in my district. Ang pinakamalapit pong level 2 or level 3 hospital is in Region 1 Medical Center, which is 2 hours away in my district. So if we have an emergency patient sa 6 na bayan po ng first district, kailangan pang magbiyahe ng 2 oras. So the first legislative district actually is sa population of 400, almost 500,000 population. So ibig pong sabihin nito, the current bed capacity is 196. Meron po tayong deficit na 268 to achieve the Department Health's recommended ratio of 1:1,000. So furthermore, healthcare facilities in the district are either under-equipped or have no little improvements since their establishment. Dahil umaasa lang po kami sa provincial hospital. So alam naman po natin na very, very limited ang pondo ng probinsya. So with this, there is really a need to establish an additional health facility at the heart of the first district of Pangasinan, especially so that more or less 1 million tourists oftenly visiting our district, being the host of the 100 Islands. Nasa Alaminos City po kasi ang 100 Islands. And the city is willing to donate 2 hectares of our property in the city of Alaminos just to accommodate this project by the Department of Health. So considering these factors and needs of my constituents for accessible and quality healthcare, I humbly seek the support of this committee for the immediate passage of this bill. Thank you, Mr. Chairman, the colleagues, and to our visitors from the Department of Health.
Thank you very much, Honorable Celeste. Engineer Ruiz of the Department of Health.
Thank you, Mr. Chair. So good morning again, Mr. Chair and Honorable Representative. So allow me to present again the DOH position paper on House Bill number 8198. So the Department of Health acknowledges the intent of the House Bill number 8198, which seeks to establish a 100-bed capacity hospital to be known as the Alaminos General Hospital in Alaminos, Pangasinan. The hospital is proposed to be under the direct supervision and control of the Department of Health. Pangasinan has an estimated bed to population ratio of 1:1,353 based on the province 2023 Philippine Statistics Authority. Population is stated of 3,191,000, which is beyond the ideal of 1:1,000 ratio. Of the 40 licensed hospitals in the Pangasinan, 25 are privately owned, 14 are under the local government unit, and 1 level 3 DOH hospital. The Region 1 Medical Center is a level 3 DOH hospital in the province, which is designated a specialty center for renal care and transplant, burn care, mental health, geriatric care, cancer, and dermatology care. Universal Healthcare Act envisions a province-wide healthcare provider network, which must have a level 1 hospitals and at least level 2 or level 3 hospital, which the province satisfy. The Philippine Health Facility Development Plan 2020-2040 provides that the projected gaps in the province by 2025 for level 1 and level 2 hospitals are 4,367 and 157 beds respectively. In consideration of the foregoing, the DOH interposes no objection in the establishment of the Alaminos General Hospital, provided that it shall remain under the direct supervision and control of the province pursuant to Executive Number 138, Series of 2001. The establishment of the hospital will aid in closing the gap for hospital beds in the province. Maintaining the ownership and control of the hospital under the province shall ensure that the healthcare provider network is able to deliver continuous health from the primary to tertiary care providers. Again, please note the disposition paper will be sent to the committee once signed by the Secretary of Health. Thank you, Mr. Chair.
Thank you, Engineer.
Mr. Chairman, may I also add to
Thank you very much, Engineer Ruiz. Yes, Honorable Estrella.
Mr. Chairman, another reason also for the filing of the bill and the need of the hospital is because if you will look at your census, the district has a lot of GIDA places, geographically isolated, depressed areas. And so there is a real need for the establishment of a level 2 hospital, Mr. Chairman. Thank you.
Any other comments from the members?
Mr. Chair,
Yes, Honorable Ong Chuan.
Mr. Chair, I move for the approval of House Bill number 8198, an act establishing a general hospital in the city of Alaminos, province of Pangasinan, to be known as the Alaminos General Hospital, and appropriating funds therefore.
I'll second the motion.
So there's a motion to approve House Bill number 8198, duly seconded. Hearing no objection, House Bill number 8198 is approved. Congratulations. Before we proceed, we'd like to acknowledge the presence of our Vice Chair, Honorable Ray Florence Reyes of Party List Anak Kalusugan, Honorable Emerson Pascual of the 4th District of Nueva Ecija, Honorable Edvic Yap of Party List ACT-CIS, Honorable Marlene Premisias Agabas, our Deputy Majority Leader of the 6th District of Pangasinan. Thank you very much. Next. We now go to House Bill number 8365, authored by Honorable Florida Rida Robes. Honorable Robes is now recognized.
Thank you, Mr. Chair. Magandang umaga po sa atin lahat. Let me all greet you, of course, isang maulan at sana po'y bumangon na po tayo sa bagyong ito. First, I would like to express my gratitude to the Committee on Health for assisting our district for the passage of Republic Act 11272. However, establishing of specialty hospital in our city to be known as St. Bernadette Children and Maternity Hospital during the 17th Congress. Malaking bagay po ito sa amin, Mr. Chair. Today, I'm here to present House Bill number 8365, proposing an amendment to Republic Act number 11272, indicating the location of the hospital in San Jose del Monte, Bulacan. Mr. Chair, The passage of this bill is earnestly sought. Thank you very much at magandang buhay po sa ating lahat.
Thank you, Honorable Robes. Engineer Ruiz of the Department of Health.
Thank you, Mr. Chair. Thank you, Honorable Representative. So the Department of Health acknowledges the intent of the House Bill number 8365, which seeks to amend Section 1 of the Republic Act number 11272, otherwise known as an act establishing a specialty hospital in the city of San Jose del Monte, province of Bulacan, by omitting Barangay Graceville as the exact location of the proposed hospital. This legislative measure shall provide the local government unit of the San Jose del Monte, Bulacan ample time to evaluate and determine a strategic location that will serve and deliver continuous health care to its target patients. Also, the measure will give more flexibility to the said LGU in terms of the facilities, catchment population, and accessibility. The Department of Health interposes no objection to the proposed amendment, stating that the hospital shall be located in the city of San Jose del Monte, province of Bulacan, provided that the establishment of the said health facility shall be in accordance with the Department of Health's regulation standards. Respectfully submitted. Thank you, Mr. Chair.
Thank you, Engineer Ruiz. Any other comment from the members?
Mr. Chair,
Yes,
yeah.
Honorable Reyes.
if there are no other comments or objections, I do move to approve House Bill 8365. So
Second the
Mr.
motion. Mr. Chair.
There is a motion to approve House Bill number 8365, duly seconded. Hearing no objection, the House Bill number 8365 is approved. Congratulations, Honorable Robes.
Thank you so much. Sa ngalan po ng distrito ng lungsod ng San Jose del Monte, maraming salamat po mula sa aming puso. Thank you, Chair.
We go now to House Bill number 3141, an act is increasing the bed capacity of the Tamaran District Hospital, province of Lanao del Sur from 25 to 100 bed, amending for the purpose Republic Act number 3607 and appropriating funds therefore by Honorable Zia Alonto Ajong and Yasser Alonto Balindong. But since they are not present, we now recognize Honorable Ong Chuan to sponsor in their behalf.
Thank you, Mr. Chair. In behalf of the sponsor of House Bill number 3141, namely Representative Zia Alonto Ajong and Representative Yasser Alonto Balindong. Mr. Chair, I move that we adopt their explanatory note as their sponsorship speech. Thank you.
Thank you, Honorable Ong Chuan. Engineer Ruiz.
Thank you, Mr. Chair. Good morning, honorable representatives. So allow me to state the DOH position paper. The Department of Health supports the House Bill number 3141, which seeks to increase the bed capacity of the Tamparan District Hospital in Lanao del Sur from 25 to 100 bed capacity. Lanao del Sur has an estimated hospital bed to population ratio of 1,000 to 5,291 based on 2022 projected population of 1.1 million, which is below the average of 1:1,000 bed to population ratio recommended by the World Health Organization. There are 8 licensed hospitals in the province. 3 hospitals are privately owned and 5 hospitals are under the Ministry of Health, Bangsamoro Autonomous Region in Muslim Mindanao. The Philippine Health Facility Development Plan provides that the gap for level 1 and level 2 hospital beds in the province by 2025 are 1,863 and 861 respectively. The Tamparan District Hospital is a level 1 hospital with an authorized bed capacity of 25 beds and is under the supervision and administrative control of the MOH BARM. Based on the MOH annual hospital statistical report in 2019, its average bed occupancy rate was 139%, which is above the ideal BOR of 80 to 85%. In view of the foregoing, the Department of Health interposes no objection to the proposed increase in bed capacity of the Tamparan District Hospital. This will help close the gap for level 1 hospital beds and strengthen the province healthcare provider network catering nearby municipalities within 1 hour. The Department of Health shall continue to support the province based on the national allocation framework of the PHFDP 2020 to 2040 and the Department of Health Evolution Transition Plan, where Lanao del Sur is classified as Category 2. Please note that the DOH position paper stated will be sent to the committee once signed po by the Secretary of Health. Thank you very much, Mr. Chair.
Thank you, Engineer Ruiz. Comment from members of the committee?
Mr. Chair,
Honorable Ong Chuan,
Mr. Chair, I move for the approval of House Bill number 3141.
second. So there's a motion to approve House Bill number 3141, duly seconded. Hearing no objection, House Bill number 3141 is hereby approved. Congratulations. Before we proceed, we'd like to acknowledge the presence of Honorable Reynante Arrogancia of the 3rd District of Quezon and Honorable Ricardo Cruz Jr. of the 1st District of Taguig Pateros. Thank you.
Sir, for the record lang po. Okay, manifest lang po na we also requested for the deferment of this.
For the record, the House Bill, the local bill, House Bill number 7870, an act renaming Valenzuela Medical Center to Antonio Serapio Medical Center, amending for the purpose Republic Act number 9421, entitled an act upgrading the Valenzuela General Hospital in the city of Valenzuela, Metro Manila, into 200-bed capacity tertiary level hospital to be known as the Valenzuela Medical Center and appropriating funds therefore. I was informed this morning that the authors, Honorable Wilfredo Mark Enverga and Honorable Eric Martinez, requested that the deliberation of House Bill number 7870 be deferred. So we will now, for the record, defer the deliberation of this bill. We now proceed with bill on national significance. The bills establishing the e-health system. We now call the authors of the bills. First in the list is Vice Chair Honorable Attorney Mike Tan on his House Bill number 290. Honorable Tan is now recognized.
Thank you, Mr. Chair. Magandang umaga po sa ating lahat. Sa lahat po ng nanditong kapwa members of the House and sa ating pong resource persons. House Bill number 290 seeks to institutionalize a system of providing wide access to quality health information and services using information and communication technology that is referred to as the National E-Health System. Its application in the country's health system is expected to result in better health outcomes for every Filipino as it stands on the whole of society and whole of government approaches. As early as 2005, the World Health Assembly already recognized the potential of e-health to strengthen health systems and improve quality, safety, and access to care, and encouraged member states to take action to incorporate e-health into health systems and services. Consequently, under the Philippine Health Agenda strategy, the letter I in the acronym ACHIEVE is referred to as Invest in E-Health and Data for Decision-Making. The PHA identified this guarantee on access to health interventions through functional service delivery networks, which shall be enabled by telemedicine to expand access to specialty services. It bears stressing that the investment on building access to health services is a crucial requirement for the realization and success of the universal health care for all Filipinos. Hence, investing in e-health, most especially for those in geographically isolated and disadvantaged areas, and particularly for the poor, disadvantaged, and vulnerable, is highly important. It also reinforces the need and importance of quality access to real-time information for evidence-informed decision-making. Once enacted into law, the National eHealth System, as it is now being proposed, will recover all existing healthcare providers and other entities developing and using eHealth systems, services, and applications and tools, whether public or private, including relevant standard equipment in the field of health and ancillary services that use ICT and are complementary to existing minimum modalities or standards of healthcare and other means of access to information. The bill also features the establishment of an independent body to be known as the eHealth Policy and Coordination Council, implementation of eHealth services and applications, formulation of the human resource for eHealth development plan, establishment and maintenance of the necessary national ICT infrastructure to implement eHealth services and applications, as well as the National eHealth Data Center, and development and monitoring of the strategic framework and plan to serve and guide the operations of the NEHS, among other activities. Mr. Chairman, dear colleagues, the reimagination and transformation of our health system by improving its effectiveness, increasing accessibility to health services while containing healthcare costs and working toward a universal healthcare for all Filipinos. These are the things that we seek to accomplish in enacting this important health measure that is now before us. Thank you and good morning.
Thank you, Honorable Tan. Before we proceed, we'd like to acknowledge the presence of House Committee Member Honorable Ernesto Junicio Jr. of the First District of Manila and Honorable Franz Castro of Party List ACT Teachers. We now call on Honorable Harris Christopher Ong Chuan on his House Bill number 4138.
Thank you, Mr. Chair. Good morning, everyone. Mr. Chair, in the interest of time, I move for the adoption of my explanatory note as my sponsorship speech.
Thank you, Honorable Tan. House Bill number 5485 by Honorable Ernesto Junicio Jr. Honorable Junicio is now recognized.
Good morning, Mr. Chair. Good morning to my distinguished colleagues and guests. I would like to manifest that my explanatory note be adopted as my privilege speech, Your Honor. Thank you very much.
Thank you, Honorable Junicio. We now go to House Bill number 4808 by Honorable Edvic Yap. Honorable Edvic Yap. You're now
Good
recognized.
morning to Honorable Chairman Siriaco Gato Jr., my dear colleagues, our distinguished guests, and all resource person and attendees of this hearing. Along with my co-authors, Representatives Eric Yap and Paulo Duterte, it is an honor to sponsor House Bill number 4808, or the eHealth System and Services Act. Among the priority of legislative measures of no less than His Excellency President Bongbong Marcos is e-governance, which manifests the need to capitalize on the country's digital infrastructure following the said gradual transition. In fact, digitalization is prevalent in transactions such as online banking, commerce, learning, and the like. Health is among the primary duties of the state. The protection and promotion of the right to health of the people and availability and accessibility of health services are guaranteed by the Constitution. During the COVID-19 pandemic, on-site delivery of health services became generally limited or restricted, resulting to the use of online health consultations that guarantee the ease and efficiency of healthcare delivery. In relation to the government's direction towards e-governance and effective and efficient delivery of healthcare services, this bill seeks to institutionalize a system that provides a wide access to quality health information and services using information and community technology, referred to as the National eHealth System. In view of the foregoing, the approval of this bill is earnestly sought. Thank you, Mr. Chair.
Thank you very much.
House Bill number 3590, sir.
We now proceed with House Bill number 3590 by Honorable Representative Ching Bernos. But since Honorable Representative Ching Bernos is not present, Honorable Edvic Yap will sponsor in her behalf.
Yeah. Good morning, Mr. Chair. On behalf of my good colleague, Congresswoman Ching Bernos, I respectfully move that we adopt the explanatory note of her proposed House Bill number 3590 as her sponsorship speech. So move, Mr. Chair.
Thank you, Honorable Edvic Yap. We now proceed with House Bill number
1184, sir.
1184 by Honorable Christian Teliap. Honorable Christian Teliap is now
Good morning,
recognized.
Mr. Chair. Yes, I move that my explanatory note be my opening statement for my bill for the EL. Thank you.
Thank you very much, Honorable Yap. Before we proceed, we'd like to acknowledge the presence of Honorable Salvador Prieto of the 6th District of Bulacan. And of course, Honorable Christian Teliap of the 2nd District of Tarlac. And Honorable Yevgeny Vincente Imano of the 2nd District of Misamis Oriental.
Kanina si Congressman Lacson.
May pinuntahan daw siya, so one-minute suspension. Meeting is now resumed.
Mr. Chair,
Yes, Honorable Chuan.
Mr. Chair, I move that the following House Bill, namely House Bill number 523, House Bill number 644, House Bill number 1784, House Bill 2847, House Bill number 3039, House Bill 3659, House Bill 4322, House Bill 4795, House Bill 5417, House Bill 5681, House Bill 6250, and House Bill 6521. Mr. Chair, I move that the explanatory note of these House bills be adopted as their sponsorship speech.
Thank you, Honorable Chuan. Okay, so we now proceed with the comments from our resource persons. May we now call? Yes, Honorable Plato.
Before we ask our resource
Can I just say a few words?
Yes, Honorable Prieto, you're now
I
recognized.
applaud the efforts of my colleagues in proposing the e-health system and services act with the developments in the information technology and the constant use of the internet. We must take advantage and raise those in the remote areas in promoting the health services available to our constituents. I just have a few clarificatory questions regarding the House bills, Mr. Chair. Number one, who will primarily handle the operation of the e-health system? I understand that this is a health-based program, and the Department of Health should be the assigned department. Yet there is also too much technicalities that are involved in this health system. Is DOH also equipped with the technical know-how? And number two, in case the main system that carries the e-health system becomes unavailable due to technical problems, what is our backup plan or system so that the inputs already existing will not be deleted, nor the entire system be aborted? Thank you, Mr. Chair.
Thank you very much, Honorable Prieto. We will let your questions be answered after the presentation or of our resource persons. So we now call on our resource person from the Department of Health, Director Gloria Nenita Velasco of the KMITS. Director Velasco is now recognized.
Yes, thank you, Mr. Chair, and good morning po. The Knowledge Management and Information Technology Service of the Department of Health supports the noble intention of this body on the filing of bills establishing the e-health system in the country. The DOH recognizes that an effective e-health system is instrumental to attaining universal health care for all Filipinos, as it not only enables easier access to health services, but also addresses disparities in service delivery and improves the flow of health information toward the achievement of better and equitable health outcomes. The Philippine National E-Health Program hosted at the department is one of its kind in Southeast Asia, having had demonstrated considerable successes since 2013 through its forging of high-level stakeholdership among the Secretaries of Health, Science and Technology and the Philippine Health Insurance Corporation. The institutionalization of critical e-health components on standards and interoperability, ICT infrastructure, human resources and capacity development, strategy and investments, and e-health services and applications has paved the way for foundational reforms in the way information and communication technologies are used to improve the delivery of health services. However, changing leadership over the years has slowed down the progress of e-health implementation in the country, and more so during the COVID-19 pandemic, wherein program direction shifted to supporting the national interagency governance for COVID-19 pandemic response. The DOH is cognizant that it is high time to institutionalize the e-health system in the country. It recognizes likewise that ICT investments are beyond what the DOH can assume on its own. Thus, the DOH respectfully provides the following recommendations for consideration of the authors for the bills being filed. On health innovation, to consider discussing the socioeconomic impact of health innovation in terms of certain indices, such as the Global Innovation Index. On the declaration of policy, to anchor e-health reforms on Republic Act 11223 or the UHC Act, in particular, mainstreaming of primary care interventions and creation of healthcare provider networks. On the objectives, to include the creation of e-health plantilla positions and leadership roles within healthcare provider networks, such as the assumption of chief information officer positions and the development of e-health cadre, such as data scientists, cybersecurity experts, and enterprise architects. On the implementing agency, to revise the term National E-Health Services Bureau to the Digital Health Office, which uses UN agencies such as the WHO and International Telecommunication Union, their term for the broader e-health agenda. On the e-health policy and coordination council, we recommend streamlining membership of the council to focal agencies that can commit funding support and harmonize ICT-related resources, programs, and projects on health, and the use of health-related data across national agencies. We also recommend that the Council steer resource sharing, vetting, and release of data standards to be enforced to achieve interoperability, health information exchange, and payment for drugs, medicines, and services. We also recommend that the Council focuses on main areas such as enterprise architecture or planning, standards and interoperability, capacity development and research, and data privacy. On the rationalization of e-health services and application, we recommend that a holistic approach be institutionalized towards long-term enterprise architecture implementation, which will control unnecessary IT infrastructure costs and better inform appropriate IT investments toward efficiency. On regulations of telehealth services and e-health related devices, we recommend to build capacity towards risk-based regulatory frameworks on telehealth to ensure their safety and quality in augmenting health services. On the scope of health services and applications, we recommend removing the section to promote inclusivity of future digital health interventions. On human resources and e-health, as aligned with the National Human Resource for Health Master Plan, the DOH recommends the following to encourage the development and growth of an e-health cadre. First is to define or identify professions of human resources and e-health as contemplated, to include IT professionals, health professionals involved in providing e-health services, and other administrative staff relevant to the delivery of such services. We recommend as well inclusion of individuals with postgraduate degrees related to e-health, such as Masters of Science in Health Informatics. Second, we recommend including e-health topics or concepts in health and allied health curriculum in the same manner that e-health topics may be incorporated in the curriculum of IT or computer science professionals. This could be further explored as a specialization or track under these programs. Third is to develop competency standards for e-health professionals to guide the learning and development interventions and other capacity development packages to be provided to e-health professionals. And fourth is to study appropriate organizational structures, required competencies, job descriptions, as well as job pricing appropriate for e-health personnel, considering the existing labor market for health information technology. With the foregoing, we recommend that a technical working group be formed in order to refine the provisions of the bill. And we will also be submitting the official DOH position paper together with the other detailed recommendations, one signed by the Secretary of Health. Thank you very much.
Thank you, Director Velasco. May we request Director Velasco to please submit your position paper to the committee. Thank you. May we now call on Ma'am Jovita Aragona, the Senior Vice President, Chief Information Officer, Information Management Sector of PhilHealth. Ma'am Aragona, you're now recognized.
Okay, good morning to all. Good morning, Honor. So in coordination with the Department of Health, we actually collaborate and coordinate with them continuously, especially that the PhilHealth is also part of the National eHealth Program of the Department of Health. We actually support the bill and more further comment suggestions in our position paper. So this e-health bill will be able to establish the appropriate governance for the entire Philippines. And we will be now in the position to move towards integration and harmonization of our systems. And we'll provide the appropriate interoperability so that all systems in the country will be integrated and will be able to move forward. For our actual comments, so the first one would be on the creation of the eHealth Policy and Coordination Council. So we believe that government agencies in the council will be appropriate because this will have strong commitment, especially that we have government agencies in the eHealth policy and coordination. For the standards compliance, we recommend that it must be aligned with the Universal Healthcare Act and its implementing rules and regulation, such that all the public and private, national and local health-related entities shall be required to submit health and health-related data to PhilHealth through a National Health Data Repository. The National Health Data Repository has been cited in Section 31 of the Universal Healthcare Act. Now, this is a very important reform or very important strategy because this will actually harmonize, integrate all the data that we have in the country, and this will give us the unified analytics that we are longing for several decades and several years. But with the e-health bill, so this can be further strengthened because it will be under a good governance structure, which is the e-health policy and coordination council. So placing this one in the e-health it will have more direction, it have more guidance and more governance structure. So we actually recommend also that an article in this one is the National Health Data Center, but we have to emphasize that it will be sectoral, or it will be the combination of the Department of Health and also PhilHealth and the DICT. So the inclusion of the National Health Data Center supports also the Universal Healthcare Act of Section 31, and more importantly, it will be the arm also of the e-health services in the country. So the National Health Data Center is twofold function. So the physical infrastructure will be with the support of the DICT, and probably will be the DICT for the physical infrastructure. But we have to consider also that there are some functional aspects of that data center, like the formulation of the standards, setting policies and guidelines, and making collaboration with the different stakeholders. So we also would like to incorporate that human resources be incorporated also in the establishment and strengthening of the health data center. And the human resource particularly refers to the personnel who shall design, develop, operate, support, and maintain the National Health Data Repository. And the human resource must have the necessary knowledge, skills, expertise, and experiences to undertake the National Health Data Repository activities as well as the tasks. For the scope of e-health services and application, we would like to recommend that there should be a good distinction between the mandatory e-health data services and also the other services compliant to the e-health services applications, including the one that are not limited, for example, for the health passport, health facility operations, telehealth, telemedicine, human resources, and enterprise resource planning. So that's all, Mr. Chair. Thank you. Thank you very much.
Thank you, Ma'am Aragona. May we now call Undersecretary David Almirol Jr. of the DICT.
Your Honor, good morning, Your Honors. The Department of Information and Communications Technology, or DICT, fully support the establishment of the e-health system and its services, or so-called the e-health bill. The ICT can hold a critical role within the health policy and also coordination. And as a key member, the DICT collaborates with relevant government agencies. In fact, we recently signed collaboration agreement with DOH and PhilHealth to unify our strategies and initiatives to make this happen, and to formulate and promote essential policies, including guidelines for effective coordination and implementation of the e-health system and its services. Leveraging on the expertise of the ICT, we are here to also help establish and maintain national ICT infrastructure to support the seamless operation of e-health services and its applications. The financial support will be also encouraged further to make sure that we have more innovative and advanced e-health technologies, while other stakeholders, of course, as mentioned a while ago, universities or hospitals, private entities, non-government organizations are encouraged to contribute to the development of e-health initiatives as well. The ICT also ensures and recommend a comprehensive and interconnected nature of e-health system through our e-government platforms and initiative. Recently, we launched a lot of unified platforms, including centralization of citizen-centric platforms, like the eGov Super App, the eLGU, the eTravel, and other citizen-centric solutions that this kind of technology can be integrated to make sure that we have technology not only accessible, but also implementable, and also prepared in a certain maintainability, including longevity as well. A unified and centralized system can be established to make sure that this cannot be Aningas Kogon moving forward. I think the ICT can help do the integration, interconnection, and also collaboration to other agencies so that all the system will be implemented through this initiative and bill will be established in a long-term manner. Thank you, Your Honors.
Thank you, Undersecretary Almirol. Before we proceed, we'd like to acknowledge the presence of our Senior Vice Chair, Honorable Anthony Goles of our party list, Malasakit. We now call on Undersecretary for Legislative Affairs under the PPG, Undersecretary of the Department of Social and Welfare Development, Fatima Alia Dimaporo. Undersecretary Dimaporo, you're now recognized.
Thank you, Mr. Chair, and a good morning to all distinguished representatives. As lead agency in social protection, the Department of Social and Welfare Development fully supports the subject measures that seek to establish and institutionalize the Philippine Electronic Health, e-health system and services to ensure efficient access to quality healthcare information and services, especially for the poor, vulnerable, and marginalized, and those in geographically isolated and disadvantaged areas, or GIDAs, through the use of information and communications technology, ICT. In addition, the DSWD welcomes the opportunity to be a contributing member of the E-Policy and Coordination Council that will be created. The participation of the department in the council will enable meaningful discussions that will ensure the relevant policies and guidelines for the effective coordination and implementation of the proposed measures that will be inclusive and inequitable. Thank you, Mr. Chair.
Thank you very much, Undersecretary Dimaporo. We now call on from the Department of Science and Technology, Director Franz De Leon.
Good morning, Mr. Chair. The Department of Science and Technology fully supports the bill. I represent the Advanced Science and Technology Institute, which operates the National High Performance Computing Facility. We call it the Core Computing and Archiving Research.
Are you Director Franz De Leon?
I am
Okay.
Director Franz De Leon, sir.
Thank you.
Morning po. So on our end, our National High Performance Computing Facility can provide the resources needed for the compute and data storage, similar to what we have done with FASTER. That's an application that co-developed with the Department of Health. So the DOH needs to identify the requirements for the data repository and then decide where they want to locate this. So our facility can be considered as a location, especially if they expect to do a lot of data processing. Then it would be a logical decision to have this in a single location, considering our facility or to be one of the facilities that would be established. That would be all. Thank you very much.
Thank you very much. May we now call on Honorable Vergis Buena from the Professional Regulations Commission. Oh, Honorable Bayani San Juan.
Good morning. Thank you, Mr. Chair. Thank you, Your Honors. The PRC is represented here by the three regulatory boards, health regulatory boards, the Board of Medicine, the Board of Nutrition Dietetics, and the Board of Radiologic Technology. May I be allowed to read the doc position paper of the PRC and with the information that a newer version will be given this morning to us. The doc position paper on House Bill numbers 523, 644, 1184, 1784, 2847, 3039, 3590, 3659, 4138, 4322, 4808, 5417, 5681, 6250, and 6521 are all similarly entitled an act establishing the Philippine e-health system and services in the support of using information communications technology in the Philippines and appropriating funds therefore. The Professional Regulation Commission has previously expressed support for similar measures proposed by the House of Representatives during the 18th Congress before the COVID-19 pandemic. In light of the new normal conditions, the Commission reaffirms its strong support for these initiatives in the Congress. These proposed measures align with the vision of the World Health Organization, which recognized the immense potential of an e-health system as early as 2005. The WHO acknowledged e-health as a means to strengthen health systems, enhance quality, safety, and accessibility of healthcare services towards its full integration into the healthcare system. In recent years, the various phases of quarantine have seen the emergence of telemedicine, e-prescription, and other e-health services, which have proven to save countless lives through contactless transactions and virtual or remote interactions. The Commission commends the incorporation of standards of care, accreditation, competencies, and accountability measures in the proposed bills. With the Commission's involvement in the e-health policy and coordination council, it can provide and promote relevant policies and guidelines for the effective coordination and implementation towards the effective delivery of e-health services within the context and thrust of the Universal Healthcare Act, and using the whole of society and whole of government approach. To further enhance the bills, the Commission and the different professional regulatory boards of the health cluster would like to respectfully submit some proposals and recommendations for this honorable committee's consideration. Number one, review the definition of telehealth and telemedicine, specifically if these terms would cover teletherapy, telepulmonary rehabilitation, among others. Number two, alignment of these bills with already existing regulations as such as those being implemented by the Food and Drug Administration, the Dangerous Drugs Board on the matter of electronic prescriptions. Number three, proposal to further study the provisions relating to electronic health records and electronic medical records from the standpoint of data privacy considerations. Number four, support for the inclusion of the Commission in the e-health policy and coordinating council, as well as in the development of the standards of practice and implementation of certification mechanism for healthcare providers providing healthcare services. In conclusion, as the fourth industrial revolution rapidly integrates into our daily lives, further accelerated by the pandemic, it is imperative to establish newer, faster, and safer means of communication and transactions to safeguard the health of our fellow countrymen. The measures under consideration will bridge the gap caused by physical distancing, benefiting millions of Filipinos where during a pandemic or in times of instability. The Commission expresses its gratitude for the opportunity to comment on these vital legislative measures. Thank you very much. Please take note that we will be submitting our more recent this morning. Thank you.
Thank you very much, Honorable Bayani San Juan. May I remind all our resource person to please submit your positions by paper to the committee. Thank you very much. Before we proceed, we'd like to acknowledge the presence of Honorable Jaisal Victoria Yu of the 2nd District of Zamboanga del Sur.
DBM, sir.
May we now call on Attorney Carlos Borja Jr. of the Department of Budget and Management.
Good morning, Mr. Chair, and to the members of the committee. For the Department of Budget and Management, for our initial comments, we generally support the creation of the council. With the establishment of the council, government agencies and instrumentalities concerned could align and harmonize their respective efforts related to the matter. Further, we interpose no objection to the proposed conversion of the existing Knowledge Management and Information Technology Service into a full-fledged bureau. We likewise concur with the proposal that the Bureau shall serve as a secretariat to the Council. However, to limit the operational cost for the purpose, we deem that the provision of the administrative, logistical, and technical secretariat services should be undertaken by the organic personnel of the newly created Bureau. That's all for now, Mr. Chair. We will be submitting our official position paper. Thank you.
Thank you, Attorney Borja. From the Department of Interior and Local Governments, may we now call on Attorney Jasmine Maruhom.
Good morning, Mr. Chair, and to the honorable members of the committee. On the part of the DILG, the department supports the passage of the proposed establishment of electronic health or e-health system and services. No less than the 1987 Constitution, specifically Section 11, Article 13 thereof, provides that the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people. Nevertheless, for the enhancement of the subject bill, we respectfully offer the following comments and or recommendation for consideration. On Section 7, regional and local implementation structures and staffing pattern, it provides that, in part, local organizational structures shall be subject to the discretion of the local government units in relation to Section 76 of the Local Government Code. As could be gleaned from this provision, the establishment of local government or local organizational structures is contingent upon the discretion of the local government units. On this point, Mr. Chair, it may be prudent to expand this provision.
Can you speak closer to the mic? I'm sorry, I cannot hear well.
It may be, okay, am I coming through clear po? Thank you. It may be prudent to expand its provision to include a clear provision as to what kind of assistance and what function should LGUs perform vis-a-vis the implementation of this measure at the local level para po ma-avoid natin yung possible duplication ng function. Further, it may also be prudent to indicate the level of local government units, so provincial level po ba, or pati barangays, city and municipalities. On Section 10, it may be wise and prudent to include a definitive period upon which the council shall create multi-sectoral groups. And lastly po, on Section 26, we respectfully suggest the inclusion of a definitive period upon which the council shall promulgate rules and procedure regarding the administrative violation and complaints. What we're trying to avoid here po is yung situation where meron ng administrative violations or complaints, but the same cannot be addressed because wala pang na-promulgate na rules and procedures po. So hence the suggestion. Thank you po.
Thank you, Ms. Jasmine Maruhom. Before we proceed, we'd like to acknowledge the presence of Honorable Ramon Rodrigo Gutierrez of Party List One Rider, and Honorable Eulogio Rodriguez of the Lone District of Catanduanes, and Honorable Bulut Begtang of the Lone District of Apayao. From the National Privacy Commission, we now recognize Attorney Natasha Fortea.
Hi, good morning. Thank you, Honorable Chair, and good morning to everyone and my fellow resource persons. On behalf of the Commission, we would like to reiterate our full support to the proposed measure, as we fully understand that we as a society must uphold the rights of every Filipino to quality healthcare services. We respectfully note that the Data Privacy Act of 2012, or the DPA, shall apply to the processing of personal information and sensitive personal information, collectively personal data. This includes the implementation of reasonable and appropriate physical, technical, and organizational security measures, and most importantly, in upholding the rights of the data subjects. Our official position paper with our detailed comments is already in the final stages of approval, and we will be submitting it once it is signed. Thank you. That's all.
Thank you, Attorney Fortea. From the Philippine Statistics Authority, may we now call Attorney Eliezer Ambatali.
Good morning, Mr. Chair. Good morning to our good legislators, and good morning to everyone. we in the Philippine Statistics Authority would like to express our support in the passage of this e-health system bill. And we would like to express that in the PSA, we will be both a contributor and a user, considering that we have a lot of services that will be linked or will be beneficial, or we have to be benefited by this particular bill. We would like to point out that the Philippine Statistics Authority is the primary lead agency in the identification or the Philippine Identification System. And we are also the lead agency in the civil registration. These two services of the PSA are very much linked and should be interoperable also with the e-health system. And we would like also to point out that together with the DICT, the DOH, the PhilHealth, that we are a member of the proposed joint administrative order that proposes the National Health Data Repository. And with this bill, if we have the data repository, we would be able to better generate statistics or information that will guide our policymakers of formulating better policies for our citizens. We would also like to inform the committee that the PSA is monitoring around 53 sustainable development goals related to health. And by that, we will be a user of this e-health system, specifically the data that will be generated for this. We would also like to point out that we have a community-based monitoring system in the PSA that would monitor the local situation, data statistics on the local level, and that uses the CBMS is basically utilizing a geographical monitoring or geographical mapping of locally based health facilities. And we would like to inform that we can use the e-health system if it's interlinked with that with the system in the CBMS. Can be beneficial also to the formulation of or delivery of the health services. We would like to inform the committee that we will be submitting our written position paper once it's signed. That's all, and thank you, Mr. Chair.
Thank you, Attorney Ambatali.
Council for Health and Development.
And last of our resource person is from Council for Health and Development, Dr. Julian Francis Lee.
All right. Thank you, Mr. Chair. Good morning to this august body. I am Jillian Lee, currently a physician for the Council for Health and Development, a national organization of community-based health programs in the Philippines. Prior to this, I worked as the Provincial Health Officer of Dinagat Islands and served under the DOH Doctors to the Barrios program in Tubahon, Dinagat Islands. First of all, we would like to thank the House of Representatives for its acknowledgement of the Constitution's provision on the people's right to health. While it is
may delivery ako, Grab. Ikaw na mag-papunta. Antayin mo muna. Mamaya mo na lang.
Especially to the most vulnerable sectors of our society, we would also like to put forward our concerns regarding the legislative proposals for establishing electronic health or e-health systems in our country. We believe that any law on health using information and communications technology must first and foremost be governed by guardrails that protect and promote human rights, including the right to health. The lack of comprehensive safeguards to respect, protect, and fulfill the right to health may undermine the rights of patients, health workers, and vulnerable groups. Without these, existing inequities will deepen, exacerbate, and increase the risk of our society's vulnerable groups to various forms of discrimination, criminalization, or even state surveillance. It is vital to adopt a comprehensive approach in the delivery of health services to ensure that public funds and priorities are not shifted away from
the primary and fundamental needs of our public health system, and that innovations in healthcare do not leave anyone behind. Expecting all barangay health stations and rural health units to use electronic health record systems and other digital health systems, for instance, without providing commensurate support, risks putting health facilities in low-income areas, particularly those in geographically isolated and disadvantaged areas, at a further disadvantage, as these facilities often lack the infrastructure needed to fully implement electronic health systems, such as computers, consistent electricity, and stable internet connections. Doubly so if the universal healthcare implementation is tied to the use of electronic health record systems. For instance, in the past, PhilHealth claims for rural health units' primary care benefits or e-consulta packages, maternal and newborn care packages, and TB-DOTS packages were required to be submitted electronically through the use of electronic medical records or EMRs and health information technology providers or HITPs, and can only be submitted within a given time frame. So rural health units and birthing facilities that provide these services but have difficulty submitting claims due to lack of internet connectivity are often left uncompensated. Multiple electronic medical records and electronic health record systems have been accredited and adopted by government and private health facilities in recent years. But the benefits of using these have yet to be seen on the ground. Ideally, EHR systems should improve clinical documentation and data management, both for individual patient records and aggregated data, and can be used to process data to support decision-making for both individual patients and communities. Real-time data aggregation through EHR systems should allow for more efficient disease surveillance, faster assessment of risk and priority areas, and more timely and accurate public health reporting. However, no standards for interoperability have yet been established, and patient data collection has to be repeated at each new health facility. The DOH still relies on the use of the Field Health Service Information System, or FHSIS, and on the individual digital databases of each vertical program, such as those for TB-DOTS, COVID, and emerging and re-emerging diseases, for collecting and analyzing epidemiological data. This lack of integration of EHR systems with the workflow processes of the existing health system increases the already extensive administrative workload of our health workers. Data privacy likewise remains a point of concern for e-health systems, especially in view of multiple recent security lapses in both government and private websites and databases. Patient information should be safeguarded and privacy and confidentiality ensured, particularly if sensitive information is to be sent over the internet or backed up to an external site. Policies on security for both hardware and software are necessary to maintain patient confidentiality and to assuage patient and physician concerns about health information. Legal frameworks regarding accountability for ownership, use, acquisition, and transfer of patient information should be established in order to prevent the sale or misuse of this information. Towards the realization of people's right to health, we urge our lawmakers to protect the people against any form or threat of privatization. We must ensure that making profit out of health should not happen in our public health system, and that our country's laws, policies, and directions should always be protective against attempts to interfere in the availability, accessibility, and ensuring quality of our healthcare facilities, goods and services by making health a privilege. In closing, it is our hope that our government will work towards primary healthcare by allocating the necessary budget and resources for health infrastructure, health human resources, and health service delivery, and establish an information and communications technology system within the framework of a free, comprehensive, and progressive public health system. Thank you very much.
Thank you, Dr. Lee. We'd like to recognize the presence of Honorable Richelle Singson of Party List Ako Ilocano Ako. Thank you. May we now ask the Department of Health to the question of Honorable Prieto, who read earlier this question. The question is DOH equipped with technical know-how?
Yes, sir. Currently, our office actually handles the e-health program, but we have ongoing effort at actually building the capacity of our office. I think just to give a bit of framing as to the very wide and large scope actually of e-health in other countries, for instance, data standards is just one part of the work in e-health. In other countries such as Australia, they have offices that are manned with that's another PIA. That offices that work specifically in standards, and they have as many as 600 people. But my view is, while we are pursuing this bill, that there are active efforts on our part, parallel efforts is actually building the capacity to actually manage all the sectoral work. And since historically as well, that our office has been the technical secretariat of the e-health program and the council.
So do we have enough technical people in the
Currently,
DOH?
no, but we are working on building that.
Okay, and his second question was in case the main system that carries the e-health system becomes unavailable due to technical problems, what is our backup plan or system so that the inputs already existing will not be deleted, nor the entire system be aborted?
Right, yeah. The system, as I understand it, is founded on interoperating existing e-health systems and applications. So it isn't a standalone system. That means that since we are interoperating, the backups of those systems will be in place. So if there is any reservation or concern rather with whether the entire e-health system will fail if there is a single problem, I think po na hindi po yan mangyayari so long as we properly manage na rin po yung incorporated systems and applications within the broader e-health system na rin po.
Okay. I think one of the main concerns of this the e-health or the by the way, what's the difference between digitalization and digitation? May we hear from DICT perhaps?
Big difference, Your Honor. The digitation is basically converting a physical document to become digital. So the like of scanning a document, let's say this is a paper. If you convert this into digital, that's called digitation. But digitalization is a wider perspective of converting manual solutions or manual operation or processes to become a highly technical system. So it will go with the software, hardware, and peopleware altogether, Your Honor. Thank you.
Thank you. I think one of the main concerns of this interoperability and the use of e-health is the breach of privacy, the data privacy. Is there such thing as a breach proof or zero chance that your medical records will be leaked to the public, considering that, of course, we all know that medical records should be maintained the security na dapat hindi nalilik sa public. Yes, Undersecretary Almirol.
Your Honor, if may I answer that question, there is, Your Honor. So in fact, there are new technologies nowadays.
There is a zero.
It's called the zero trust system.
Okay.
So the zero trust system, meaning we're giving the power of data sharing to the people. So meaning not the government anymore doing the data sharing, but the one who owns the data themselves. Recently, Your Honor, we're able to launch the eGov Super App linked to the national ID. So the same concept, Your Honor. So meaning the data is stored by the government, but the only entity allowed to share the information is the owner of the data. So if I show the QR code, example, if I go to the hospital or I go to apply maybe a bank account or a driver's license or passport, I don't need anymore to give my information or fill up a form. All I need to do is just let them scan the QR code. Once they scan the QR code, they cannot get the information or data at all. But I receive a consent first. It says there that, are you sure you want to share your information to this entity? So what I do is I need to click yes, I want to share, and do the biometric face recognition. That's the only time that the data will be shared to the entity. So it's called the zero trust policy, Your Honor. Thank you.
And this system where there is no chance, you're saying there is no chance at all breach will be applied in this e-health system?
Data privacy, Your Honor, is a responsibility of each of the entity. Because the moment that you're able to share your data, example, if I share my data to the bank, it's the bank's responsibility to protect its own data. So there are so-called source and destination effect of data. So it's not a holistic view. It's not the ICT. It's not DOH. It's not PhilHealth. Because every time they use their data, it will be transferred to another location or another ownership of data, Your Honor. So it's actually a continuous protection of both of the data processor and then the data owner. So it's actually a continuous protection, Your Honor. It's not actually 100% precise that they can protect.
So patients and doctors can be assured that the records, the medical records, cannot be looked into by anybody, except of course the doctor or the patient or by the court if necessary.
If the technology is already established, Your Honor. But right now, we've been discussing with DOH and PhilHealth. Right now, honestly, including the EMR or the electronic medical record, is not yet unified. It's not yet solidified. So there will be more enhancements or establishments that we need to do first before going to that direction, Your Honor.
Thank you, Yusek Almirol. We now call on Honorable Robes.
Yes, good morning again. I fully understand that this is actually a goal of unifying or a unified or centralized system. Am I right? I'd like to direct the question to Yusek David Almirol. Is it a unified, it is for the centralization and a unified database?
That's, may I answer, Your Honor? That's the goal. You know, unification or so-called centralization is actually the ideal way to do innovation. Innovation means simplification. So meaning we cannot innovate without centralizing things, or else there's so many things to do. It's like building a house with so many doors, or building a building with so many buildings inside. So meaning it will be really hard to maintain. It will be really hard to do integrations. That is actually the problem, not only on the e-health side, but a lot of e-government systems nowadays. But I believe that creating a hybrid way of migration effect. So meaning we go first with the decentralization first, and then as we move into centralization, as we innovate, and then we kill the legacy systems. So actually, Your Honor, the biggest problem right now are the legacy systems. So marami pong mga systems po na na-establish ang mga hospital, LGU, ang PhilHealth, ang PhilHealth, ang DOH, pati po DICT po. Marami po kami mga tinatawag po na legacy systems. So there's no such thing as like you kill all those legacy systems and then build a new one. Normally, in the e-governance, Your Honor, pinapaganda lang minsan yung mukha, minsan ng isang sistema, pero yung likod pala naka-connected din sa mga legacy systems. Kaya hindi po gumagalaw yung innovation. That's why the e-health, if this bill will get passed, this will be a very good start, okay, for us to centralize the e-health system moving forward, Your Honor. Thank you.
Mr. Chair, one more.
Yes, Honorable Robert.
Yes, thank you so much, Yusek David. It's very well explained. So the goal, if you're there, so the main problem here is actually the budget, right? That's the reason. Once it is a bill and becomes a law, so there will be a budget and be included in the GAA. With all the expertise that you have with the DICT, so you will be the main player here in the entire system. Am I right? The DICT, for DICT and PhilHealth and DOH, DICT will be the main player?
Department of Health?
Yes, I think with indulgence of Yusek Almirol po and Ma'am Jovi, DOH will be leading overall efforts, but I think I just want to underscore the importance of multi-sectoral work, because a lot of the ICT infrastructure, those foundational infrastructure investments are related to connectivity. That is not within the remit of DOH alone. So we are partnering very heavily actually with the ICT to ensure connectivity, especially as mentioned by Dr. mga geographical, mga GDAS po, no? So very important, because Without that connectivity, I think also to underscore the importance of, yes, we want to progress with the e-health and digital work, but very mindful of that no one is excluded from this, because while we think it increased access by virtue of lack of connectivity and other ICT infrastructure needs, that can actually exclude people from from services and other e-health solutions po, no? And that is what we don't want to do. So I think we will lead po at DOH, but we will work very closely with our very important stakeholders to get all of this work moving po.
Thank you so much, Mr. Chair. But one more, because the reason why I'm asking, because there's a lot of problems with PhilHealth, okay? Marami tayo mga hindi nababayaran ng mga accounts ng LGUs and other hospitals. Ang problema ay yung connections or connectivity or infrastructures. So I just hope that once this bill be a law, sana ay matugunan natin para yung ating mga maliliit na ospital o dialysis center or cancer areas ay magkaroon naman ng pang-ikot. Kasi ang nangyayari, the infrastructure per se ang sinasabi dito. And I'm just hoping and really hoping for this goal na makatulong talaga. Lastly na lang po, with the data privacy code, I mean with the law, kasi Mr. Chair, alam naman natin na marami nagpapa-insured sa atin, di ba? Kasi ang insurance ngayon sa Pilipinas ay napakahalagang bagay o isang dokumento na pwede talaga mong sandalan pag ikaw ay nagkaroon ng problema. Ngayon, with the data privacy law na sinasabi, ang tanong ko lang, bakit pagka si insurance ay pinapa-insured si Juan de la Cruz, tapos sasabihin, ay hindi, merong lumabas sa medical records coming from hospital, hindi kita pwedeng i-insure. Ano ba ang sakop nito? Ano ba ang ibig sabihin nito? Na ang isang ospital ba ay naglalabas ng isang medical records ng isang pasyente sa isang stakeholder na katulad ng isang insurance company? Yung ba ay talagang inaalaw ng batas despite of the privacy law? Who could answer this? Yun yung narinig ko po yun eh.
Maybe from the data privacy
Yes. Hi.
attorney Fortea.
Yes, good morning. So with regard to that example po, no, halimbawa si Juan de la Cruz nagpapa-insure, the data privacy law naman allows the processing of that information. So for example, the disclosure of that information to PhilHealth, because there's that sensitive personal information, it's mandated by law that you submit that information so that ma-process yung insurance ni Juan de la Cruz. So the DPA allows that.
Mr. Chair, so it's not the PhilHealth. I'm referring to big companies like Sun Life, Philem Life, Insular Life. So since it is being allowed, tama?
Yes, it's also being allowed because if there's a contractual obligation between them, so it should be allowed kasi otherwise they won't be able to process the insurance. So
Okay,
yes.
sige, I'll take it on that. Thank you, Mr. Chair. I really would like to manifest my support with this bill, and I'd like to, of course, to make a motion na sana ay lahat ng iyong membro ng Committee ng Health o ng Kalusugan ay maging kaparte ng magandang batas na ito. Magiging batas na ito. Salamat po.
Thank you, Honorable Robes. Just a follow-up question. Are you saying, Attorney Fortea, that if Juan de la Cruz applies for insurance, the insurance company can get the records from the hospital without the knowledge of Juan de la Cruz?
Yes, actually, once they have documentation to prove their contractual relationship with each other. So by then, si Juan de la Cruz naman already entered into that contractual relationship. So to be able to avail of that services, kailangan makuha yung information niya. So yes, the answer is yes.
Without the knowledge of the applicant?
The applicant, yes, sir. Sorry. I'm sorry. Yes, because it's already in their agreement na it will be processed. So
There is an agreement.
yes,
Between the insurance company and the applicant
yes.
that to disclose this is medical records. But
Yes.
what my question is, you said the insurance company can get the medical records of the applicant without the knowledge of the applicant?
I'm sorry. I apologize, sir. No, there should be consent from the applicant.
Okay. Thank you, Attorney Fortea. Yes,
It's a manifestation, Mr. Chair. Thank you very much, Mr. Chair. I would just like to manifest my agreement to the statement of Director Velasco on the question of Congresswoman Robes, who will be on top or who will take the lead on the e-health program of the government. I like the answer of Director Velasco that the Department of Health must take the lead on this. Because when we talk about e-health or electronic health, you don't need IT experts, you need health experts. IT developers, you need it along the way, but the mainframe must be coming from the health sector. So I applaud that remark. And the ICT will just enter if you need interconnectivity later on. Thank you.
Thank you, Honorable Goles. Next, Honorable Franz Castro is now recognized.
Ano pala? Sige, sige, thank you, Mr. Chair. Magandang tanghali na sa ating lahat, sa ating pong mga kasama rito sa Kongreso at sa ating mga guest. Sa age ng computerization, IT, ideally may ganito. Pero may mga ilang concern tayo dahil as regards, Mr. Chair, doon sa preparation natin sa baba. Etong e-health system ay siguro maganda ito kapag meron talagang ma-assure natin yung ating na ma-secure ang information ng ating mga pasyente, ng ating mga mamamayan na mag-undergo dito, papasok dito. Pangalawa, ma-secure natin yung kahandaan noong yung mga regional health units natin sa baba. Handa ba yung infrastructure? So paano mapapaghandaan ng mga panukalang batas na ito yung ganong kakulangan pa nga natin ng mga health workers? Marami pa tayong dapat na intindihin doon sa pagbibigay ng accessible, free na health para sa ating mga mamamayan. At ano yung security natin na hindi ito mapapasok ng mga private sector, kasi alam naman natin may mga malalaking negosyo na kasi may provision kasi dito na may mga laking negosyo na papasok dito. At alam natin kasi ito may information dito ng ating mga mamamayan. Mas gusto natin na ma-secure 'yon. So, yun po yung aking Mr. Chair, yung concern dito sa e-health systems na ito. So, gusto nating matanong sa DOH, sa National Privacy Commission, sa PhilHealth, yung ganitong mga concern, Mr. Chair. Thank you po.
A reaction from the Department of Health?
Yes, ma'am. We agree with your statement about being very particular on the readiness of, actually, hindi pa nga lang po regional basta all levels actually. Very important po yun. So one of the major shifts that we're actually doing in the office is putting more efforts actually in ICT planning to guide investment po So our idea historically, na pag-i-invest po tayo sa IT, maglalagay po tayo ng computer pero hindi po natin napapag-isipan kung may tao po ba, may sapat na ibang hardware sa mismong opisina. Tapos I think most importantly yung connectivity po, kung may internet. So I think that's one major shift that we want to do, is better provide support actually for planning for ICT investment. And that's quite different po from yung past approach ng office po namin. But most certainly we're concerned with that. Kasi kung wala pong appropriate na ICT infrastructure, hardware, connectivity, human resource, and kung hindi rin po siya acceptable on the ground po, that's I think another point that we want to make. Of course, we want to be aggressive and innovate as much as possible, but there is the term of appropriate digitalization. Because at the end of the day, kung mababa po yung acceptability po ng solution na yun, simply put, hindi po siya magagamit. At hindi po talaga, we will not see yung outcomes na yung actual benefits of using the solution. So that's another thing that we also want to further emphasize. Appropriate na digitalization, hindi siya nag-overtake ng ibang priorities within yung mga networks. There was mention of, now we need to prioritize primary care, which we which we are totally on board with, including yung development of the healthcare provider network. So these digital health solutions, itong buong work under yung e-health should support that. No, it's to support those endeavors. I think that's in yung one thing that we want to mention. I will give the floor with regard to the other privacy concerns, but I think yung longer term solution na rin po doon is also investing in better ICT governance. No? So that means kasi yung implications po noon is that we can better plan, better implement, and also better manage po yung, kasi the reality is po ngayon, no, in terms of yung providers of e-health solutions, the majority of that is actually in the private sector. So yan po yung reality po natin. However, we can better manage, no, yung engagements with the private sector kung tayo mismo malakas po yung ICT governance, no, across the board. Hindi lang po local, even nationally. So we can ensure na data privacy is protected, and in terms of yung parang anticipated benefits po nung mismong solution, we reap the rewards from that no more effectively. So yun lang po. I will yield the floor po to NPC now.
Mr. Chair, follow up
Yes,
lang muna dun sa sinabi po ng ating representative from the DOH. So na-foresee ko kasi na ito ay talagang mapapasakamay ng mga malalaking private na negosyo. Kaya yun ang sinasabi natin kanina na ang primary concern talaga natin ay yung nasa baba, yung health services natin na nasa baba. Kaya kung pag-iisipan ng DOH, Mr. Chair, yung mga ganitong mga, kasi nga sinasabi nga, inaamin naman na may kakulangan pa talaga tayo. Lalong-lalo na doon sa mga regional health units natin. So hindi lang sa mga regional health units, doon sa mga barangay na mga health units natin. Kasi tingin ko dito sa mga nakapasang bill, naka-filed na bill, kasama din yun doon, tama po. Kaya doon po yung paghahanda na gusto natin. At kung sinasabi ninyo na hindi magiging sagka ito doon sa mas priority na primary health care ng ating mga mamamayan, so I beg to disagree kasi kung magtutuloy-tuloy ito, you have to be prepared na ma-provide din natin at the same time yung pinaka health services natin sa pagsabay nitong pagpapatupad nito later on kung ito ay magiging batas. At I hope yung DOH ay ready dyan. Kasi ngayon nga, ang realidad, Mr. Chair, di ba? Yung ating mga hospital nga, kulang na kulang ng budget. Minsan, binabawasan pa yan ng budget eh. So, paano ito ma-realize on the part of the DOH?
Yes, ma'am. I think just to clarify, we don't mean that we did not intend to convey the message na mas important yung solution sa primary care. In fact, the way that we are framing all our work right now is how do we use digital health solutions to actually support primary care and also to support yung service delivery and even yung parang system management po within healthcare provider networks po, no? Na historically, we've been really focused on yung solution, kung ano, information system po yon or application po yon. Pero now, our broader framing is how do we use this para makatulong po sa primary care. So if that means na we can possibly use solutions to reinforce gatekeeping or to better link people to primary care services, yan po yung framing po namin. So hindi kami parang solution-driven lang po. It's ano yung problem na gusto nating i-solve when it comes to yung experience ng isang pasyente para mas seamless po yung patient journey nila within the health system. Yun yung we-focus po natin. I think very important now, we need to maintain yung privacy and data privacy of people. That is foremost. And I think yung pinaka also look out for ng department is to ensure na pag ginamit po to lahat, no, at the end of the day, we achieve equitable health outcomes. Kasi there are instances talaga na because of the solution, hindi natin napaplanuhan ng maayos, walang connectivity, nawawala ng serbisyo, and we don't want that to happen. So yung sa amin po, more investment and resources and efforts actually at providing better guidance and support subnationally po para mas better po yung planning po natin. Hindi po napapag-iwanan yung ibang areas po.
Yes, Honorable Franz Castro.
Meron po bang DICT rito, Mr. Chair?
May we hear from the DICT, Undersecretary Almirol.
In this bill, Your Honor, so our task is just a technical assistant to DOH. So basically, they will be since they will be the primary entity to implement the e-health. So as mentioned above, if they need connectivity, like internet connectivity, maybe in the future, if they need also integration to other agencies, so we're there to assist Your Honor. So basic example, Your Honor, for PhilHealth, we are doing some enhancement on the connectivity. We're able to deploy some enhancement there. So if e-health systems need that integration in the future, we're willing to assist, Your Honor. Thank you.
Mr. Chair, may I continue? So how ready is our infrastructure? Kasi basic na pangangailangan yan dito sa e-health system. Kasi Mr. Chair, just to compare, no, sa ngayon nga pinag-uusapan natin yung connectivity sa mga eskwelahan na kahit na ma-provide ng public Wi-Fi, free public Wi-Fi ang ating mga paaralan ay hindi nagagawa. So gaano tayo ka-prepare dito sa infrastructure na tingin ko gargantuan din ito. Kasi kung lahat ng mga facilities ng health ay aanuhan natin ng connectivity ay talagang napakalaking napakalaking trabaho. So how ready are we? Meron na rin po ba tayong naka-prepare na plan o roadmap, whatever it is, na mag-support po dito sa project na ito ng DICT po?
Yusek Almirol.
Yes, Your Honor, there are a lot of plans, especially on the connectivity side, and these are the critical infrastructure areas, including health centers moving forward. In fact, the ICT, although it's not my domain on the connectivity because I'm handling e-governance, Your Honor, but there is a plan to finish the establishment of more than 10,000 sites, free location sites of the ICT. So hopefully, the ICT will able to accomplish that in the next couple of years, Your Honor. Thank you.
Thank you. Thank you, Mr. Chair. How about po yung NPC, National Privacy Commission?
From the National Privacy Commission.
Hi, ma'am. Yes. So with regard to data privacy, as mentioned earlier, yung infrastructure, our only comment there is there should be, prior to the launch of that integration, there should be, we highly recommend the conduct of a privacy impact assessment. So this process shall be done to enable to identify and address the possible risks that will be involved. Because of course, we recognize na unavoidable yung risks. So in the conduct of that privacy impact assessment, ma-identify siya and then the effects thereof will be mitigated. So para lang alam, tas ma-ready kung ano yung possible risks.
May I continue, Mr. Chair? Kasi sinasabi dito sa bill at with the DOH representative, so parang tinitingnan natin na yung participation ng mga private sector. So kung magmamaterialize itong bill na to, so hindi lang yung DOH hospitals, hindi lang yung mga provincial hospitals, mga regional hospitals, barangay unit hospital, health centers, pati yung mga private sector, mga private hospital. So paano yun i-connect sa lahat? So magkakaroon talaga ng isang malaking voluminous data ng mga tao yan. So paano magagawa ng security ng NPC etong pag-secure ng privacy? Kasi alam niyo, Mr. Chair, di ba, alam naman natin yung health data and information ng isang tao ay very essential and vital yan. At hindi pwede yan matingnan o makita ng kahit na kanino na without consent ng patient. So paano nyo po yan mapoprotektahan sa ganong kalaki na data po sa iba't ibang sa iba't ibang units ng hospitals?
Yes. Sa ganyang case po kasi ma'am, in that instance na pag mag-i-interconnect, yung mga hospitals na may hawak na information, they will remain to be the controllers. So sila po yung may obligation under the Data Privacy Act to ensure the protection. So yun nga po yung sinuggest namin earlier that they should conduct the privacy impact assessment so that they can properly identify and assess the risks that may happen. And also para ma-mitigate yung effects nun, especially on the data subjects.
So may balak pa, halimbawa, sabi nila kung yung hospital sila yung in charge doon sa data ng kanilang mga patient. So natitiyak ba natin na hindi ito gagamitin sa, sabihin na natin, sa extreme cases na nangyayari naman yun yung mga hacking, yung ginagamit yung data para sa ibang mga purposes. So meron po ba tayong kumbaga itatalaga na privacy personnel para ma-ensure, kasi lahat ngayon, di ba, may batas na tayo na lahat ng mga agency, including private sector, may mga magsisecure ng privacy noong company na yon, na hindi ito mahahack o hindi ito magagamit ng sinuman, whether nasa loob siya ng company niya or sa labas. So paano po niya matitiyak? Yun po ba ay magiging trabaho din ba, Mr. Chair, nung itatalagang, ang tawag ba natin doon, yung may nilalagay kayo doon, yung privacy personnel
Sorry ma'am. Yes, actually, the DPO po, Data Protection Officer.
Yeah,
The DPO po is hindi po siya part ng National Privacy Commission, but part po siya nung, halimbawa, ng hospital. So employee po siya ng hospital, and that person is in charge of the data protection protocols of the controller. So siya po yung nag-i-implement ng mga policies and yung security measures on how to secure the data.
Manifestation na lang, Mr. Chair. So ideally, 'di ba, sa isang lipunan na napoprovide natin yung sapat na serbisyong pangkalusugan sa ating mga mamamayan, ideally okay sana ito, no. Pero ang primary concern natin ay syempre yung budget, yung facilities, infrastructure, at yung ating seguridad ng ating information. So sana ma-consider later on sa ating mga pag-uusap pa kung mag-perform, Mr. Chair, ng technical working group, mabusisi natin itong mga binanggit ko kanina at talagang syempre ang primary naman sa amin, sa Makabayan Block, ay yung talagang accessible, free health services po sa ating mga mamamayan. Thank you, Mr. Chair.
Thank you, Honorable Castro.
Mr. Chair, just
Yes,
very
Honorable
short, Mr. Chair.
Emano.
Yeah, would like to ask DOH, Mr. Chair, would like to follow up the line of questioning of Kong Plato. In our, we're considered a third world. Philippines is considered it's as a third world country. Have you visited or benchmarked on a country where they have a successful e-health system?
Not yet,
Director
sir, no,
Velasco.
pero not yet, sir. But actually, yung benchmarking po namin is efforts na ongoing na rin po ngayon . So as far as I understand po, walang country actually na single system maliban po siguro sa Estonia. I think they're an outlier. Pero for most countries, their system is really founded more on interoperability, meaning nag-uusap po yung mga systems po nila. I can't give specifics yet nga po, pero to varying degrees of success na rin po . I think siguro most important for UHC actually, although important yung information exchange, is really that it supports service delivery first and foremost, and that the information that actually moves between the systems nagagamit po ng mga tao either to make decisions on kung saan ako pupunta na facility, kung healthcare provider po ako, na I can actually say, I'll refer you to this other facility kasi wala kaming service na ganito ngayon. And then for mga local health systems managers, they can actually make better decisions, kung may kulang na gamot sa isang area, because I have information on this, I can actually move it to other places.
Yeah, but the question is, you haven't
Not yet.
benchmarked.
Not yet po.
And the model that if you were given a choice, Estonia would be hopefully will be the model that we would like to replicate in the country. Is that what you're saying, ma'am?
No po. For government services, maybe that is possible. Like as what the ICT is actually undertaking po ngayon, mga government transactions. Pero for other services na very specific po, I think the reality is kasi we have so many players and providers already in the market. So the idea is rather than having a single system, a single provider, and even based on our experience office with the systems that we've been providing, really big issues in scaling na national po talaga lahat, no? Yung reality is even for EMR providers, iba-iba din po yung nagpo-provide nun. But very important is that whatever the provider is, and preferably of choice po nung facility or nung LGU, basta nagko-comply lang po sa standards and nag-interoperate yung systems and secure po yung data. No, we protect yung privacy po.
Mr. Chair, would the DOH happen to know if we have, we keep on looking at Estonia and other first world countries, if there are Filipinos, Mr. Chair, who would be able to help with the system, with the law that we will be creating, Mr. Chair?
Yes, we're fortunate to have an engagement with the AHIN po. It's a regional network on e-health. So we can definitely bring them in as resource persons. Likewise, we also have, we'll be forging communities of practice maliban po sa AHIN po, also with our Government Hospital IT Association of the Philippines, and also engaging with the private sector through the League of Corporate Foundations po. So we can get additional inputs na rin po from them. The AHIN can provide the international perspective. So they've had a number of years of experience already po, no, in terms of knowledge na rin po, and even sharing of experiences from other countries that have endeavored to undertake this work po.
Thank you. And the same question, Mr. Chair, with the DICT. Have they benchmarked or have learned already from other first world countries with the system that, DOH is, we would like to thank all those who are joining us, especially the research speakers, Mr. Chair. But I think heavily the bulk of work will be for DOH and the ICT.
Yusek Almiron.
Mr. Chair, Your Honor, for us, we're benchmarking Singapore. So we studied their system. In fact,
e-health system, Mr. Chair.
e-health is actually part of the whole technology ecosystem of the government. Because identity, protection, interoperability, and other functionality mula pinanganak hanggat mamamatay yung tao is actually a journey, and e-health is actually on that layer, Your Honor. And Singapore, hindi pa kompleto. We discussed to them. We've met some of their technology expert, and they were able to establish a foundation of the e-health, and based doon sa simula is the foundation. The information should be a single entry policy, which is Estonia is also doing that, para hindi pa ulit-ulit. Ang pinaka-problema kasi, especially po sa Pilipinas or other Asian countries, is yung wasak yung data natin, Para bang paulit-ulit yung entry, And if we're able to have a system, this is, I think, and I believe that this bill will actually put a solution to that. Once we have the single entry policy ng dato natin, mas matipid, mas mura, at mas mabilis po gamitin ng pangkalahatan. Hospital man yan, insurance company man yan later on, or PhilHealth man yan. So that is the idea and solution po na po pwede po. So Singapore po, nakita po namin po na medyo effective po ngayon, Your Honor, Mr. Chair.
Mr. Chair, and the reason I'm asking it, Mr. Chair, because earlier, following the question of Congresswoman France, is that is more concerned on the development of and improvement of the healthcare system in the barangay level. And DOH was able to answer it, Mr. Chair, that of course they're looking at the barangay health stations will not, or primary care will not be left out. May I ask the ICT, Mr. Chair, how much did Singapore invest for the system? If they were able to benchmark, Mr. Chair.
Yusek Almiron.
Malit lang po kasi, Mr. Chair, Your Honor, ang Singapore, kaya mabilis i-implement. So our challenge, we are archipelagic nation po, and then tama po yung din kanina, that connectivity is also one of the challenge, and because some of our locations wala yung mga gita sites natin po, hirap din sa connectivity. That's why parallel po yan, and as the ICT and maybe private and the ICT, as they move into putting connectivity all throughout the country, sumasabay dapat po yung innovation. So nag-establish na po yung pinaka-foundation. So once we're able to have that foundation, hindi na po kailangang ulitin po because technology is not something to build again and again and again. Once you establish a foundation, it can fly on its own. Ang problema lang, if the system is puro vertical ang inaayos natin, tayo ng sistema, without solidifying the foundation, gumuguho po. Kung mapapansin niyo po, well, hindi naman po Pilipinas lang, but even other countries, masarap magsimula ho ng sistema eh. Pero ang question minsan, ba't di nagtatagal? Bakit after 3 years, wala ulit yung sistema na yon? Bakit yung kabilang sistema, inuulit yung ginawa ng kabila? Yung kabila, inulit-ulit. So, I think the communication of technology is very important. That's why if you allow Mr. Chair, the ICT can come into the picture, not only the connectivity side, but also on the interoperability side. Example, Mr. Chair and Your Honor, we're able to launch the ELGU system recently. So we're able to establish around 210 LGUs. Pero ang trabaho lang po noon is yung pinapanganak, namamatay, kinakasal para automatic yung pong recording system. Business permit, pag-a-apply ng permit, sanitary permit. Imagine, parehas lang po yun is a data gathering facility para magkaroon ng automation, papasok kay DTI, papasok kay SEC, papasok kay LGU, papasok kay PSA, para magkaroon ng holistic dashboard or overview ng national government. Pero kung lahat ng mga yan po ay kanya-kanya ng datos, at ang tao naman po lumilipat, pumupunta sa iba-ibang LGU din, if we're able to ride on that single entry policy, kasama po ang e-health, malaki ang chance po natin po na makapag-establish tayo ng maayos na e-health foundation, Your Honor, Mr. Chair.
Thank you, Mr. Chair. And Mr. Chair, I again would like to thank all the resource speakers, especially our colleague from the 14th Congress, Congresswoman Alia Dimapuro, who congratulations, who just recently got appointed as Undersecretary of DSWD, Mr. Chair. And Mr. Chair, I heard a lot of the resource speakers. I heard the concerns. And would it be possible, Mr. Chair, if I may suggest that we now create a technical working group to consolidate and invite those the resource speakers and the technical people, Mr. Chair, to sit and maybe create recommendations and for our committee, Mr. Chair.
Can you put that in motion, Honorable?
So move, Mr. Chair, and if I may suggest, the very seniorist, Mr. Chair, Congressman Goles would head the technical working group.
Any second?
So move, Mr. Chair.
Second, Mr. Chair.
Mr. Chair, may I add? Yeah, may I add po?
So there's a motion by Honorable Emmanuel, duly seconded, that we create a technical working group to harmonize, refine, and so that there will be more, we can improve or we can perfect the bills on e-health. Hearing no objection, the motion to create a technical working group to be headed by our Senior Vice Chair, Honorable Goles, is approved. Yes, Director Velasco.
Yeah, yes, may I add? Siguro I just wanted to qualify my statement. We haven't done a deep dive na benchmarking po, no? Pero most recently, a few months back, we participated in a global benchmarking na exercise called the Global Digital Health Monitor po. So within that particular benchmarking na, it's a monitoring tool actually, the Philippines sits with majority of countries in terms of yung majority ng global digital health. So from a scale of 1 to 5, we sit around 3. We noted now we regressed a bit after the pandemic, but we are very intent on actually making progress on that. That is one. So in terms of how far off we are compared to other countries, not actually that far off. There are only very few countries that rate very highly on the monitor itself. And across the board for all countries, including for the Philippines, yung capacity is really the weakest part. So I think if there are stronger provisions within the bill, I really strongly recommend also concentrating on that po, no? And hindi lang po individual capacity. We're talking about yung capacity ng institutions like hospitals to better protect yung data kasi that's very sensitive personal information, but also broad yung capacity development po na kailangan for the entire health sector po, and even with our alongside po yung mga partner na agencies po namin and their sectors. So yun lang po.
Thank you, Director Velasco. Are you a doctor? Director?
Yes po. Yes.
Okay.
We'll
Thank
be
you.
happy to share a more detailed discussion of the Global Digital Health Monitor po.
Any other matters that the members would like to take up or?
Mr. Chair, may
Yes,
I?
Honorable Singson.
Since we're all talking about a strong foundation and the importance of centralization and interoperability, I would like to know under whose responsibility will we put the interoperability on? Because it's so important that before we even spend budget on digitalization, that all the data that's being used by all medical facilities is the same type of coding. And I know there are a lot of different standards all over the world. But for the Philippines, we need to establish who will be responsible for creating this strong foundation.
Director Velasco.
Yeah, that would also be with DOH, and that's one with DOH na rin po. And that's one of the areas of e-health that we really need to strengthen, no? There isn't really a shortcut to data standards, but definitely the standards are important so that we can actually facilitate interoperability.
Yeah, so who would it be under? Would it be under DOH or DICT, or will we create a new committee that will ensure that the data standards and the centralization is intact, and at the very beginning it's implemented?
The technical work can be lodged under DOH.
DOH heading?
Yes po.
Okay, thank you, Mr. Chair.
Thank you, Honorable Singson. Favorite motion?
Mr. Chair,
Yes,
if there are no more any matters to discuss po, I move to adjourn.
so there's a motion to adjourn, duly seconded, hearing no objection. This Committee on Health meeting is hereby adjourned. Thank you very much, members of the committee, and of course, thank you very much, our esteemed resource person. We'd like to congratulate your very comprehensive position on this matter. Thank you and good morning.